But we begin this noon with breaking news. Governor Gretchen Whitmer asked for a 2-week pause on some activities as COVID cases surge in Michigan. Calling Michigan a national hotspot for COVID, the governor says that this is the time for everyone to do our part, with Michigan leading the country in COVID cases. Now, she is asking for a 2-week suspension of in-person high school classes, 2 weeks after the end of spring break, along with a pause in youth sports and indoor dining. She is asking. Rod Maloney joins us now. These are recommendations, but not new restrictions and mandates. She made that clear.
Yeah, she made that clear, Rhonda, in that she's not going to be doing mandates, at least at the time being. She's saying that essentially this is on Michigan, and everybody needs to step up and go back to the things that everybody knows works: the masks, the hand cleaning, staying away from people, social distancing. And so when she goes and tells the schools that she wants them in hybrid learning now for the next couple of weeks, also have the pause with school sports, no practices. She doesn't want those. She's also saying that that it's a situation where the state needs to step up because we're getting to the end of the tunnel here and we can't just step back. She said that, look, everybody's tired of all of this, but that we need to continue on to get to the end because she believes vaccines can be the answer. Let's hear a little bit about what she said about why she's doing what she's doing.
Policy change alone won't change the tide. We need everyone to step up and to take personal responsibility here. So I'm not taking any options off the table, but in this moment, we are strongly urging that public schools and youth sports voluntarily take action. We are strongly urging restaurants and diners to be smart and eat outdoors or get takeout.
And so this leaves a lot of questions. How do the restaurants feel? What are the school districts going to do? Will there be all virtual learning now? The school districts have wrestled with this for a very long time, and some districts aren't going along with what the governor has to say. So we're going to take a closer look at all of this coming up on Local 4 News at 4, 5, and 6 o'clock with team coverage to make sure that you understand exactly what the issues are and what the governor's decision today means. Reporting live in West Bloomfield, Rod Maloney, Local 4.
All right, Rod, thank you. And of course, most importantly, she wants everybody to get vaccinated. The state's top medical executive, Dr. Janae Calhoun, says that we are on track to see a surge of cases greater than we had in the fall. Hospitalizations have more than quadrupled in a month, and some hospitals are postponing non-emergency surgeries because they are reaching capacity with all the COVID patients.
We need everyone to do their part, not only to protect themselves. Think about the person who may have an underlying medical condition or who is older and is more likely to die from COVID-19. Think about the person who may need to have a surgery or seek emergency care, and the staff or beds may not be available in the hospital. This is serious. We are all connected and we're in this together.
And we are gradually seeing this all play out in our medical institutions across Metro Detroit. Dr. Calhoun says that more than 15% of hospital beds are now being used to treat COVID patients. In fact, the Detroit Medical Center just announced today that it is imposing new visitor restrictions at all of its hospitals. No one is allowed to visit patients, with a few exceptions like people in serious or critical condition. And today the governor reiterated that vaccines, that is the way that we will help end this surge. So get it, don't hesitate, get it as soon as possible. By the end of the day, the state says that 5 million doses of the vaccine will have been administered to nearly 40% of the state's population, but we need to get to 70%. As Rod mentioned, we are gathering reaction to the governor's announcement, talking to schools, talking to hospitals, talking to restaurants, so we will have complete coverage for you starting on First at 4. Meanwhile,